as we discussed, what are the guidelines for use of oseltamivir, but this, as the heading is there, that antivirals and controversies associated. So there were there. So we will discuss certain controversies associated with oseltamivir. In past, there has been certain events of abnormal behavior and disturbance of consciousness in children in Japan. Okay, but however, the subsequent studies they were carried out for association of this abnormal behavior and disturbance of consciousness and oseltamivir, but they have found that there is no such much relation between the use of oseltamivir and the neurological issues. But yes, this issue was raised in 2007, and that's why the label updating of label of warning against rare adverse events has been included in oseltamivir. Again, there was a British experience. Then this incident happened in 2009 when a symptomatic case in local school happened, and in order to protect other children, all school children started with 7 days of oseltamivir prophylaxis to all school kids. One kid was detected, and all school kids were started with oseltamivir prophylaxis. So again, at that time, the use of prophylaxis in as a oseltamivir as a prophylaxis had been discussed widely. So that was again issue in which the drug landed in controversy, because whether to use oseltamivir such rampantly for all individuals who came in contact, that was in controversy. Then again, the Cochrane reviews were there. Then the Cochrane collaboration published their analysis of neuraminidase inhibitor, and different reviews came, and there were certain the questions raised on oseltamivir against the benefit of oseltamivir against the cost ratio, and the how improvement in patients. The oseltamivir was found ineffective in asthmatic children, and so why? So these are the questions. Why was there no reporting of neuropsychiatric events? Why was large scale trial was not recommended during pharmaceutical industry? Why had there been no study on the relapse of cases after oseltamivir? Why was adverse event profile studied till treatment lasted? So these are all controversies were raised, but subsequently large scale data, large scale analysis, large scale studies were done, and all these controversies were addressed. Okay, so despite all these controversies in past, and with large amount of evidences, new evidences coming up, oseltamivir is the preferred drug for treatment in standard guidelines of various countries, including CDC, IDSA, European guidelines, NICE guidelines, Government of India guidelines, Indian Academy of Pediatric guidelines. So as of now, we have oseltamivir as a a brahmastra against influenza infection, but we should use it judiciously so that resistance for oseltamivir should not rise. Now again, certain controversies, as Sir told. In certain settings, benefits have been observed even if treatment started later than 48 hours, as we discussed. There was an observation study by Mutri et al. In patients hospitalized with influenza PDM09, that's pandemic strain, and this suggested that effect on mortality with treatment initiation up to 5 days. So there is definitely role of oseltamivir after 48 hours in seriously ill patients who are admitted up to 5 days of onset of symptoms. Okay. Then earlier observation studies in those hospitalized with proven seasonal, pandemic, or avian influenza also indicates some reduction in mortality with oseltamivir treatment started within 4 to 5 days. So the crux is that if you have a child who got admitted with respiratory distress, no respiratory infection, you are suspecting influenza-like illness, and even if 48 hours are passed, you can still start the anti-influenza treatment up to 5 days, and definitely it will be beneficial. Then there was certain people try to use higher doses of oseltamivir in seriously ill ICU patients by doubling the dose. Okay, so that's why I told you how the 300 milligram came previously. Okay, so they used to double the dose, 150 milligram twice a day. Okay, mostly this was done in adults most of the times, not in pediatric cases. But there are many studies which disapprove this idea, showing no virological or clinical advantages with double dose oseltamivir compared with standard dose in patients with severe influenza admitted to hospital.